Ready? Okay, so we're going to begin. My name is Peter Colosi, and I am Associate Professor of Philosophy here at Salve Regina University. And I'm very involved with an organization called the Catholic Medical Association. I teach medical students every summer with medical doctors about medical ethics from a Catholic perspective. So I'm steeped in that realm of ideas. I'm not a medical professional myself, although I'm around the doctors and I do my best to keep up on things, and we have a doctor in the audience, so he's going to help me if I need help on any of that. And this is definitely a medical ethical topic that we're talking about, brain death. And I gave 2 previous talks here at Circle of Scholars, but they weren't like, some of the talks are like 3 that go together. These were just all 3 of mine today, and these 2 were independent. But the genesis of today's talk was because in one of those 2 talks, it was the top one about death and dying, a question came up in the Q&A about brain death and organ donation. And I answered it, saying what I think, briefly. But there's a vigorous debate about brain death within Catholic medical ethics, there's disagreement, and within the whole secular medical world, there's disagreement. And I have a view on it, which is going to come out during the talk. And before we get into it, I just want to say something like, we probably all, myself included, know people who have participated in one way or another, donating, receiving an organ, or medical professionals who do transplantations and so forth. And what I'm talking about is unpaired vital organs. So like both lungs, or the heart, or the whole liver, or the whole intestine, means when you take that out of the person, they're not going to be alive after. Okay, that's what I'm talking about. I want to go over, hopefully quickly, a few points about maybe 6 or 7 slides from my first talk. I don't know if any of you were at that talk about end of life from a Catholic perspective, but it will help us understand some of the deeper questions with brain death when we get to that. So maybe 10 minutes on this little review of one of those talks. So this question about dying, going through the dying process. There's this foundational question. Is the sick or dying person placed at the center of attention? Or is the sick or dying person abandoned, isolated, and ignored? That's a question. There's 2 basic ways that people can die. One of them is die a natural death, and one of them is die by being killed. A natural death would be dying of old age, illness, organ failure, disease, injury, or a true accident. Being killed, that would be somebody killing somebody or killing oneself. Those are 2 different ways to die. In that earlier talk, I was talking about euthanasia and physician-assisted suicide, or what they like to call now medical aid in dying. And these are 2 people you might have seen in the news. One of them is Brittany Menard, and the other is Terri Schiavo. And Brittany Menard, both of these were national, international stories. She had a large, benign but large growing brain tumor, and lived in California and decided she wanted to go to Oregon because physician-assisted suicide wasn't legal yet in California, and it was in Oregon. She went there with the support of her husband and her mother and got the prescription to take the overdose to kill herself. So that was physician-assisted suicide. That's active euthanasia. Terri Schiavo, the most important thing to remember about her case is she was not dying. She was just a vulnerable person who needed extra help. And she was breathing on her own. She wasn't dying. She could relate to her mother. And there, if you remember the whole court case, the final verdict was remove the feeding tube, and she died a gruesome death, 13 days of starvation and dehydration. It was horrific. So that's euthanasia. In Rhode Island, there's this bill, comes up every year, the Lila Manfield Sapinsley Compassionate Care Act, which would make it legal for doctors to prescribe a lethal dose of medicine to some patients for the express purpose of enabling them to use it to kill themselves, including at home. I put the word 180 there because whenever one of these bills gets passed, you go from a situation where you do a 180. You go from a situation where, in a jurisdiction where doctors will never use their skills and training to kill a patient. They will either cure or care, but never kill. Once you legalize that, even if it's just for one, they load it up with all these restrictions before the person can get at the beginning. Those restrictions all go away over time once you do the 180, which I explained in the other talk. The 180 is, now you're saying in your jurisdiction, doctors will use their skills to kill a patient. That's a 180. It hasn't passed yet in Rhode Island. It's legal in about 10 states and Washington, D.C. This, though, raises the question, can it be morally acceptable to refrain from or cease medical intervention? So is that killing someone if you don't give someone some medicine or some treatment that they need? And the answer is, yes, you can refrain from it. It's not killing somebody. It could be in some cases. So when is it morally acceptable to remove or to refrain from giving someone some medical treatment? And in the Catechism of the Catholic Church, it says, it makes a distinction, and this is an ancient distinction, between extraordinary treatment and ordinary care. So extraordinary treatment is it's optional. Discontinuing medical procedures that are burdensome, dangerous, extraordinary, or disproportionate to the expected outcome can be morally legitimate. It's the refusal of overzealous treatment. That's a big problem we have in our day because medicine is so far advanced. We have so many ways to just keep people going. So over-treatment is a problem sometimes. Here, if you refrain from or take away extraordinary treatment, it's not killing this person. You're not willing to kill them, and you're not actually killing them. The way I like to say it, so like an example would be if someone has chemotherapy and the cancer comes back, and then they say, let me try the next recipe's protocol, and the cancer comes back, then the person might want to say, you know what, it's time, right? That's not euthanasia. That is the humble acceptance of the approach of death, because none of us can avoid death. We all have to die, and when it's present, you can accept it. And then you turn to family and prayer and things like that to go through the dying process. Death is unavoidable, eternal life, but ordinary care, which I'm going to talk about in the next slide, is never discontinued. That would always be against love. In this case of removing extraordinary treatment, the patient dies a natural death, not killed. And then to die is a human act, and it's a very important one, which I'll talk about again in a minute. Ordinary care, even if death is thought imminent, the ordinary care owed to a sick person cannot be legitimately interrupted. Such treatment are those that offer a reasonable hope of benefit without excessive burdens. So I'm going to put all of them up here really quick because I take my time in the other talk. But basically, people often say when you're doing extraordinary, ordinary, you're explaining that distinction to people, they always say, give me a list of ordinary. But the problem with that is it varies from case to case. Something like the antibiotics one for a secondary infection down there. Once I said in a talk like this that antibiotics is ordinary care. What it means is somebody's got some serious disease or illness, but they also have a secondary infection which antibiotics would relieve them and give them a little comfort. So there, you wouldn't say, don't do it. Maybe it'll make them die sooner. That would be horrible if you didn't give them the antibiotics. So the antibiotics in that case would be ordinary care. But then one doctor raised his hand, and I'm always grateful when they do this and correct me on the medical points. He said in some diseases, antibiotics would be counterindicated because they can exacerbate certain other issues. So it's not always ordinary care. But things like comfortable room temperature, bed care make sure they don't get bed sores, and all those things on there. If you don't give those to somebody who's sick, that's mean. Okay, so ordinary, you want to love the person, and most importantly, you want to, keep holding their hand and so forth. And okay, I'm not going to do the longer lecture on this. So if you ask people today how they want to die, what do they typically say? They don't even want to know what happened. Do you know that there used to be a prayer prayed regularly by Catholics that was, "O Lord, deliver me from a sudden death." Oh Lord, deliver. People used to pray for the exact opposite of what everyone wants today. Something dramatic has changed. We have a completely death-averse culture. We hide sick people away, and so on and so forth. And the reason, which I went over in the other talk, is that death is a very important act to go through the dying process. You might make the most sincere confession you've ever made in your whole life. You might suddenly find the courage to say something to someone that you've always been afraid to say, and reconcile, or at least repent, or whatever. Here you have a beautiful picture. People used to meditate on their upcoming death, even when they were healthy. It was part of normal religious practice to prepare. And so there'd be pictures like this in books. And the guy you see, I said at the beginning, is the sick person at the center of attention. Well, he's in the center, the geographical center of the painting, to make the point that he is in the center of attention. And maybe those are his sisters holding his hands. The pillows represent people giving him comfort. The priest is preparing the sacraments. Maybe that's his widow in mourning, or maybe it's a nun praying. His friends are maybe talking about his will. If you look in the back, it's kind of interesting. It looks like a doctor checking a urine sample there. And then you have the window with the three black panes, because it's tough to go through this. But one pane is open with light, and that's this hope for eternal life. So people used to just think about all this, and they said, when it comes my time to die, my people are going to be here for me. Now, I'm very grateful, and I'm sure you are, for modern medicine. I've benefited from it in ways that I'm very grateful for. So this next slide is not like a wholesale rejection of modern medicine, but compare that to that. This person is just alone, holding a metal bar, not a human hand. That's maybe one of the reasons why people want to die quickly, because we don't have all this love and understanding about the meaning of going through the dying process. That's a quick summary of the other talk I gave. So now, today's talk is about brain death. So, and I want to say that I really just have a modest goal in this talk, which is to show you some things that aren't, although now it's more and more in the news. You may, if you follow this at all, it's being reported in the New York Times. I'm going to give one example, and in Daily Mail. So we'll see. But it's only recently. But this battle about brain death has been going on since 1968. And I want to bring up the side of it that hasn't gotten as much coverage and is never really talked about in medical school. The medical students that I meet every summer, they don't even know about this side of the question. And some of it might be triggering, as they like to say these days. So you can just listen to it and think about it. And I'm going to give you some tips on where you yourself could go learn more about it yourself online. Okay. And this will be a mixture of some Catholic points and some just basic points. And this slide is a mixture of both. So the Catechism says, organ donation after death is a noble and meritorious act. But it is not morally admissible to bring about the disabling mutilation or death of a human being, even in order to delay the death of other persons. So what that means is we shouldn't be reducing each other to things or objects. You shouldn't be just, treating, like in these movies, like the movie The Island, where these rich people create clones of themselves just to get organs out of them when they get sick. There's a whole movie about that. And this idea of thinking of other humans as just, something I can use and throw away, that's a horrible. Every human being has equal worth and dignity, and we shouldn't be treating other people as a means to my ends. So that's kind of what's behind that, the infinite dignity of every person. In secular medicine, this is called the dead donor rule. And what the dead donor rule means is that if you're going to take an organ out of somebody, or the taking of which, if they were alive, would be the act that kills them. You can't do it. You have to wait until they're dead then you can take that organ out. That's the dead donor rule. So the question is the dead donor rule being violated in cases of brain death diagnoses? Are brain dead people still alive? That's the question. That's the question that's being debated in secular medicine and within Catholic circles among Catholic theologians and philosophers who actually all agree with the magisterium, because the church hasn't made a specific comment on it yet. So, what is brain death? Because the word itself, brain death, is ambiguous. One meaning of brain death, so we have this organ in our head. It's about 3 pounds. That's what it looks like. That's a artistic rendering of it. So one meaning of the term, kind of the face value meaning of the term brain death would be that organ is dead, like necrosis. A second meaning of the word brain death used in this discussion is loss of function of the brain, which is different than the brain actually being dead. It just doesn't work anymore. Some people use the word brain death to refer to that. And I'll be talking more about it as we proceed. And then the other meaning of brain death, which is kind of the one in the back of everyone's mind, is death of the human being. So this third meaning of brain death means that if the doctors declare somebody brain dead, that means the whole person is dead. So simply put, the definition of brain death is death number 3, so death of a human being, has occurred when the brain no longer functions, number 2. That is what, and I'll show you the legal definition in a minute. That's what brain death means. If somebody has lost the functioning of their whole brain, including the brainstem, then that person is dead. That's what it means. And people are doubting whether that's true. That's the question. So, the Uniform Law Commission, that's an entity in America that is there to study hard issues and recommend laws on them, not only medical ethical things, the Uniform Law Commission. And so they put a lot of work into their thought on this, that, or the other topic, and then they throw out a recommendation, and then the states can decide if they want to adopt that as legal. Okay? And the Uniform Determination of Death Act was produced by the Uniform Law Commission with lots of doctors involved and all these people in 1981. And it said, the Uniform Determination of Death Act is a model law, so it's like a template that the states can adopt if they want to, that defines death legally in 2 ways. Either the irreversible cessation of all circulatory and respiratory functions, that's the traditional definition of death, or, and this is the legal definition, the irreversible cessation of all functions of the entire brain, including the brainstem. Now let me just expound on this a little bit. So for all of human history, you could say, that traditional definition of death is the one that we go by, that we have always gone by. It means that the heart stops and the breathing stops, and it always traditionally meant one more thing, in addition to the heart stopping and the breathing stopping, waiting, letting some time go by. Because there are things like autoresuscitation, sometimes even after longer than 10 minutes. You read these stories about people waking up in the morgue, or that's why they have the bell. Remember, in the Middle Ages, they would tie a bell to people's fingers. And it was because, okay, so it was cardiopulmonary cessation and wait. You don't have to wait till complete, rigor mortis and putrefaction, but you waited. That was the traditional definition. Okay, why do we need these? We need these because death is when the soul leaves the body. But we have a problem. There's no such thing as a soulometer. You can't see the soul leave the body. So what we need to do is look for biological signs that happened, that the soul left, that the life principle left. And so beings have always said, well, the best biological indications that we have, and by soul I don't necessarily mean a religious concept. I mean the life principle is really gone. This person is not going to be alive anymore. So respiratory and circulation stops and wait. Then you're pretty convinced we can sign a death certificate. In 1968, and I'll tell you why in a minute, and I'll show you the document, we decided that we're going to add a second way to justify signing a death certificate. And that is the irreversible cessation of all functions of the entire brain, including the brainstem. So you test for brain death, and you can say the person's dead. And by the way, those people, I'm going to give you a whole list of things they're doing, but one of the things that brain dead people are doing is their hearts are beating on its own. So, okay. How is brain death diagnosed? So AAN, that means the American Academy of Neurology. So the American Academy of Neurology has guidelines. It's a very respected organization, and it has guidelines, and it renews them every so often about how to go about testing patients to see if they are brain dead, okay? And that's what people go by. That's what doctors go by. So the tests are, the ones that are required are just clinical bedside tests. And they only test actually for brainstem function. So they check for limb movement or reflexes. They check for if they shine a light into the person's eye, a bright light, the pupil doesn't move. They turn their head, the eye doesn't move. They scratch their cornea, nothing. They put ice, oh, that's supposed to be ear. Oh no, eye twitching, yeah. Put ice water in the ear and see if they twitch anywhere. And if nothing happens. No gag reflex. And then the apnea, so all those things, they do them to the person, nothing happens. So then they're saying, brainstem, not working. The apnea test is, so people who have severe brain injuries and are in this state, they need a ventilator to breathe. And so what the apnea test, if you hold your breath for too long, you go, you want to get it back. And that's because carbon dioxide goes up. So what they do is they take the ventilator out for a while and check if the person tries to gasp. And if they do that gasping motion, then they say, oh, nope, they're not brain dead. Okay. The problem with the apnea test is it can actually cause brain death. Okay. So, but anyways, these are pretty much required, although some people only do all the top ones and not the apnea test. And why? So you might be wondering, how do they conclude if the brainstem's not working that everything else isn't working? And one of the common theories is that if a severe brain injury happened, and what happens is the brain swells, but there's a skull around it, so it has nowhere to go. Or it can actually be smushed down. In either of those cases, it pushes the brainstem down, like into the spinal cord. Okay? And so what they're doing one of the theories about why they justify just doing that, and then concluding that all function of the brain is lost, is because they're saying the only reason the brainstem isn't working is because the upper brain is dead, because it's the thing that's herniated the brainstem. Obviously, these people are unconscious, but you're going to see something interesting in a minute. EEGs and brain blood flow tests, and I'm going to talk about brain blood flow tests in a minute, those are optional. They're not required by the American Academy of Neurology. So there's a man named D. Alan Schumann, and he used to be in favor of brain death, and then he decided, he's a pediatric neurologist, and he decided, I did put MD, he's a pediatric neurologist, and he decided he was just going to study the literature, so do a meta-analysis, and lots of patients with a brain death diagnosis to check what they're like. What are they doing? And he studied about 175 of them. Okay, and here's a list of things that they're doing. I told you before, their heart is beating on its own. Sometimes it's an irregular heartbeat, but it's beating on its own. Okay, now this is an interesting one. I talked about the ventilator a minute ago. And one of the things you'll hear from the people who say that brain dead people are dead is they say that things like the ventilator is masking life or the ventilator is keeping them alive. So I'm going to say two things to counteract that. The first one is if you attach a ventilator to a corpse, it's not going to become alive again. But the second one is you have to distinguish between two levels of breathing. One is, we could call it ventilation or the bellows level. And the reason why people need to be on a ventilator is because their brainstem isn't working. And so they can't do the bellows, the diaphragm and the muscles, intercostal muscles, can't do it. So you got to get gulps of air in. That's what the ventilator does. But what's the other part of respiration? It's the exchange of gases on the cellular level. CO2 and O2 going back and forth between capillaries and alveoli. Oxygen in, CO2 out. That exchange of gases at the cellular level, the ventilator is not doing that. The ventilator is just putting a gulp of air in. The reason why respiration is happening at the cellular level is because the person is alive. Ventilator is not respirating, it's just putting the gulp of air in, I would say. They assimilate nutrition, so they're getting...
If you're on a ventilator, couldn't they check for oxygen and CO2 levels to see?
They do.
If you're getting CO2 out?
They do check for that, and they are. And they even check, they have some safety things built in place, like they max out a little bit of oxygen to try to mitigate the damage that the apnea test does, but you still have to make it so that the CO2 levels go higher than they're supposed to in order to check for the gag reflex, the gas, and that's not healthy to do to somebody. So they do measure gases during the test.
So if there's no exchange, then you say person is dead.
Well, if that would be the traditional definition of death. That would be stoppage of respiration. So actually, I'm glad you just asked that. So you have to remember that what's happening here is the person is breathing and their heart is beating. Those two things are not stopping. What? The only. Okay, so that's a good question too. So to repeat for the camera, the ventilator is breathing for them. So that is one of the responses that's often given. So let me just explain that again. The sentence, the ventilator is breathing for them, is too vague to have meaning. You have to distinguish between the two levels of things that happen when a human being breathes. The first level is gulping in air, breathing out air. If you want to pick a colloquial phrase for that, we could call it the bellows level of breathing. That part, the ventilator is doing for them. They can't do it because their brainstem isn't working. But there's a second layer, a more important layer of breathing called respiration. And that is when carbon dioxide and oxygen exchange places. That's called respiration, and it's connected to circulation. The ventilator is not doing that. The ventilator is like a bellows. If you put a ventilator on a corpse, it is not going to exchange gases. So if the body is exchanging gases, then the only thing the ventilator is doing is putting a gulp of air in. So the law is or. You either have cessation of respiration and circulation, and you can wait a little while, and you can sign a death certificate, or the person is still respirating, their heart is still beating, but their brain is dead, and you can sign a death certificate. Okay, good.
Can you have circulation without respiration?
No.
So
they're together. So But now, great questions. So now not only are brain dead people respirating and circulating, but they also are assimilating nutrition. They're on feeding tubes. Their bodies are digesting food and assimilating it. They maintain homeostasis with basic nursing care. They process cellular wastes. They have energy balance. They maintain normal body temperature. They maintain normal body temperature. Corpses don't do that. They heal wounds. They fight infections. They have febrile responses to infection, and then they get over their fevers. They respond, this is the scariest one, and I'll talk about it a little bit more. They actually respond to incisions, meaning when they start to cut open some of these people, they move or lacrimate. And there have been women who are pregnant, diagnosed as brain dead using the criteria of the American Academy of Neurology, who are, and here's when the people in favor of brain death have language problems. I don't know how they would say this, but there are women with serious brain injuries who pass the brain dead test, meaning they're brain dead, but they, the way I would say it is, keep them alive for a number of months so that the baby can gestate and then do a cesarean. Or there's one woman in Germany who actually delivered vaginally. Then, after the baby is born, they remove the life support, I would call it. They would call it something like the gestational, I don't know what they would call it, but physical machine. And then the woman died. But there's lots of cases of diagnosed brain dead women who are pregnant for months. Jahai McMath, I'll talk about it in a minute. She has 2 death certificates, one in 2014, one in 2018. And during that time period, she went through puberty. They grow. One of the cases that Dr. Schumann studied, his identity is hidden, his name's TK. He got some sort of meningitis when he was 4 years old and was diagnosed brain dead and lived for 20 years in his mother's care. And when he died at age 24, they did an autopsy, and his brain was just this little calcified chunk. They had to saw it open. He lived for 24 years. Yes, they can have heart attacks and get better, recover from episodes of hypotension. Okay, so how did we get here? How did we get to this situation where we have this new definition of death, brain death? One is because of 2 major developments historically. One is ventilator-dependent, serious brain-injured people, severe brain-injured people. So in other words, before the invention of the ventilator, all these people would have died much sooner. But now we have this, you know, and we can admit it's not uncouth to say there is an effort needed now to take care of so many more people who are alive in hospital beds because they're ventilator dependent, who not too long ago would have died. So the ventilator made people think, wow, we have a new situation. And that gives rise to the question of, are ventilators extraordinary treatment? And in many cases they are. In some cases they aren't. But in many cases they are, and so you can remove them without killing the person. Okay? So one thing that came up about brain death was, it was because of this, and then the other thing was successful heart transplants in South Africa, 2 of them. And the need for organs. So, I mean, to put it bluntly, a heart will not work in somebody else's body if you go by the traditional definition of death. Wait, cardiopulmonary cessation and wait. It won't work in another person's body. Okay. So in 1968, a group of doctors, sorry that's kind of small, but a group of doctors at Harvard University put together an ad hoc committee, and they wrote this paper called A Definition of Irreversible Coma. And this is pretty interesting historical fact that this paper is what started it all. Like, it's kind of funny how you could just put a paper in a famous journal and you change history. And this paper actually didn't use the word brain death. it said, we're going to call irreversible coma death from now on. There's no science in this paper. It's just an assertion. There's only one footnote. And that's where it was published. And you can find it online easily. It said, our primary purpose is to define irreversible coma as a new criterion for death. They gave 2 reasons in the paper for their decision. One is a utilitarian reason. This is a quote from the paper I put the emphasis on. They said, the reason why we want to define irreversible coma as death now is because the burden is great on patients who suffer permanent loss of intellect, on families, on hospitals, and on those in need of hospital beds. So that's what I said before. Now we have all these ventilator-dependent patients, and it is a burden. Whether that's a good reason to redefine death is a separate question, but it is a burden that we have to deal with. But the part that I underlined that I like to point out is, in the very document, they're actually saying that the people aren't dead. Because how could a corpse be burdened? It's like, it is a burden for the patient, if the patient's alive. And the second reason was a legal one. This is another quote from the document. Obsolete criteria for the definition of death, which is kind of funny. I mean, that's kind of strong. I would hope that at least they would keep both. Keep the cardiopulmonary and the brain death if you're, I mean, you can tell by now, I don't think brain death is death. But it almost sounds like they want to get rid of the traditional one and only have brain death. Obsolete criteria for the definition of death can lead to controversy in obtaining organs for transplantation. In our judgment, it will provide a greater degree of legal protection to those involved. That's in the paper that got all this going. What does that mean? It means if you don't sign a death certificate before you take someone's heart out, you're going to go to jail for homicide. So if we can find a way to say that people who have beating hearts are dead and then sign a death certificate, we protect the doctors who take their hearts out from being prosecuted for homicide. That's what that means. This is the document that started it all. So this woman, Dr. Heidi, so my sources. There is a few sources, and I'm also going to give you one source that argues the other side that you can look at. So Dr. Heidi Klesik and I actually have become friends, but we haven't met yet. We've been working a lot via email on this. But she is a retired anesthesiologist who, when she was and she wrote this book called The Brain Death Fallacy. And for a whole book-length study, I'll give you some links you can look things up on. But her book is excellent because she says right at the beginning, she's studied it thoroughly, and she's a medical doctor. What she does in that book is digest it down for a lay audience, all of the stuff I'm saying and much more, okay? The history of it, some of the most important cases. If you want to read a book-length study, and it's not a long book, and it's very accessible, her book. But anyways, what she starts off by saying is when she was a young anesthesiologist, like in her residency, she, for the first time, got a case. Someone told her up in the ICU, there's a brain-dead patient ready for organ extraction. You go up there and prep them as an anesthesiologist. And she's like, okay, I never did this before. And she talks about it in the book, and she says, I went up there, he looked like all my other patients. And so I figured out what I was going to do, and then my attending said, what are you going to do? And she said, well, I'm going to give him a paralyzing agent so the donor won't move. They do that, by the way. For all these cases, the heart's beating, they're doing all those things. They're breathing, their heart's beating. So some of them move when you start to cut into them. And so they give them a paralyzing agent so they don't do that. And fentanyl, to blunt the body's response is to pain. Or you could say, if they're alive, pain. But then her attending said to her, are you going to give a consciousness blocker? And she was shocked. And she said, why would I do that? Isn't he dead? And the doctor said to her, just in case. And she went and did it all. And she regrets it. In fact, at the end of her book, she asks forgiveness for that young man who she should have helped. But ever since then, she has been a troubadour for understanding brain death and explaining it to people. So on that consciousness question, it's very interesting. Among European anesthesiologists, there is an ongoing debate about whether brain-dead organ donors should be given consciousness blockers during organ procurement or just the first two types of drugs. And in the USA, there's no regulations or guidelines. So someone may give anesthesia and someone may not. This Joseph Ebley, MD, we also have become friends, very close friends because we wrote something together, but we also haven't met yet in person. But we work a lot together on this. And he's written all over the place, but there's one website called the Catholic World Report, and he's got all those articles. So if you look him up, he also has some very good, concise posts about the history of like what happened in South Africa with the first few heart transplants. And it's really interesting. He's a really clear presenter, and he has some videos too. And Heidi, I put her YouTube channel up there. Her YouTubes are great. They're so clear. They're so clear. Okay. And then, and this is one I wrote with Dr. Ebley and Dr. John D. Camillo, who's the president of the National Catholic Bioethics Center. And it's called Catholics United on Brain Death and Organ Donation. And basically what this one does, and this was kind of interesting to write with these guys because we got 151 people to sign it, including a brain death survivor, and many medical doctors. And among the 150 people who signed this document, we don't all agree with each other. There are people who signed the document who think that brain death, excuse me, I'm just going to put a holes in my mouth, who think that brain death is death. And then there are people in who signed it who think brain death is not death. I'm one of those. But the reason why we could all sign it is because what we say in the document, and we explain it in some detail, and it's a quick read also, is that the current way they test for brain death doesn't test for whole brain death. It doesn't test for it. So even the people who are in favor of whole, irreversible cessation of all functions of the entire brain, including the brain stem, think the person's dead, even they admit that the tests we're doing now don't test for that. They just test brainstem functions. And we explain in detail in our paper that depending on how you look at it, it's already widely known that either 80% or 50% of patients who are declared brain dead still have hypothalamic function. And the hypothalamus is part of the brain. Yes? Quick. Yeah. I'm not allowed to walk.
If you had a gadget that did a functional MRI,
It doesn't, okay. I'm going to comment on that in a minute. Yeah, good question. So the basic question is, are there tests that we could do that would show complete loss of function of the whole brain? And strictly speaking, currently now, there are not. And I'm going to explain one reason why in a minute. There aren't. So what we say in here, like I even had to think about whether I wanted to sign my own document because I wanted to make sure I didn't go against my own conscience. But the reason I could sign it was because what I was saying was we left it open for both views. And the thing that we were signing was all this should stop now until we have such tests. After that, we can fight again about whether those people who pass those tests are really dead. That's what this document does. That's why I felt like I could sign it. Okay. This is probably the book that the Catholics who disagree with me, except we're all doing our best to be faithful Catholics, would recommend for the other side view, making the argument that brain dead people are dead. The UDDA That is the Uniform Definition of Death Act that I talked about earlier. That's the law. I put that little R there because in 2023 there was this push to revise the Uniform Determination of Death Act by the Uniform Law Council. And they had these big meetings, like in Zoom, and Heidi and some other people I know. I didn't do it, but you could be an observer. I just didn't have time. It's not one of my main. It is kind of one of my main topics, but I didn't have time to spend observing all of them. But to make a long story short, what they were trying to do was replace. So remember how I said the law says irreversible. They wanted to replace that with the word permanent. Because the difference between irreversible and permanent is irreversible means no matter what you try, that function is not coming back. Permanent means the reason that function is not coming back is because we decided we're not trying anymore. So they wanted to change irreversible to permanent. And they wanted to allow hypothalamic function to be consistent with brain death. Okay, in other words, it wouldn't anymore be, it would be the permanent cessation of most functions of the brain, not the irreversible cessation of all functions. That's what they wanted to change it to. Okay, so there now, yes, okay.
Theoretically,
Okay.
trying to differentiate
Yeah.
sentient ability, which is us,
Yeah.
versus just the...
Gotcha. Okay, yeah. So that, and one of the things I was thinking about as I was preparing this, I had to leave so much out. But that's a whole other debate. So one thing that happened was, so he just asked, what about the difference between sort of conscious experience or even just sentient experience and just biological functions? Because you can have people, but not all. You're going to be surprised in a minute when you see something. But let's take the case of somebody who's has all those bodily functions that Dr. Schumann listed, but they're completely unconscious, true coma, not experiencing anything. And that's what the case we're talking about right now. And I'm saying they're still alive. Now, but your question, what happens with your question is, I had some slides on this and I deleted it because to save time, but what's interesting is people started realizing that it's looking kind of silly to call these people dead because their bodies are integrated. Like it's an integrated, it's not just like some fingernail still growing after, the heart's beating, the breathing, the respiration, the girl's going through puberty, they're gestating a baby. How are we going to call them dead? So one splinter group, big splinter group, said, let's make that distinction between humans that are alive but unconscious and humans that are alive and conscious. And let's call humans that are biologically alive but not conscious, and then you get a lot of different things, but some said, let's call them dead. Some said, let's call them not human. Some said, let's call them less dignified than people who are conscious. You know, what you just said, just to make it clear, to bring in another controversial topic, but it's exactly what happened in the abortion debate. So a long time ago, people used to say that whatever was in the womb of a pregnant woman, they would say it's not human, or it's just a clump of cells. But now, because of genetic testing, high-powered ultrasounds, advances in embryology, nobody anymore denies, unless they're just trying to support a position without thinking, that the baby in the womb is a new, living, growing member of the human species with its own DNA, different from the mother. You can't deny that anymore. Science has ended that question. The people who still wanted to be in favor of abortion switched to, well, okay, it's a human, but it's not conscious enough to have the right to life. To come up with a reason to still be in favor of abortion and to say it's still human, distinct from the mom. And that parallel thing happened with one group of people that I decided not to talk about in today's talk in the brain death thing. They said, since they're not conscious, but they're still alive, we can still take their hearts out anyways. So we might have to have another talk because that takes a lot of philosophy to explain. But the short answer is, you're going to go to sleep tonight. There's going to be a stage in your sleep called dreamless sleep when you are completely unconscious. If somebody could come into your room right then and kill you so quickly that it happened while you were still in the state of dreamless sleep, would that be murder? Of course, very good answer. Thank you. I'm glad you said that. What that means is, if you say of course, then you think that you, the whole dignified person who you are, is still fully there even when you are unconscious. And you deserve all the rights of everybody else. So there's no difference in the argument I just laid out between you in a state of dreamless sleep and someone in a coma. The one is just longer unconscious. The idea is, and this is why we would need another whole talk, but it's very about the dignity of the human person, because it is a dignified thing to be conscious. It's sad if somebody had to be in a coma for their whole existence. Yes, they would still be equally worthy to the rest of us. But it's sad because we're meant to be conscious and talking. But you get into moral problems when you start saying people with this much consciousness have more worth than people with this much consciousness. That's where it gets problematic. But let's just bracket that for now. But maybe we can come back to it in the Q&A, because I would like to get through this part of the slides here. And then the American Academy of Neurology, that's not a legal document. That's the paper, that's the recommendations of this medical organization. And really, for their whole history, they've always actually had in either implicit or explicit that endocrine function, neurological endocrine function is consistent with brain death. So the AAN actually violates the law. Okay, I'm gonna skip this because we're running out of time. But death is when the soul leaves the body, and John Paul did make a comment in the year 2000 where he said, this is kind of surprising, the criterion adopted in more recent times for ascertaining the fact of death, so he was aware of the brain death debate, namely complete and irreversible cessation of all brain activity, he said, if rigorously followed, does not seem to conflict with the essential elements of a sound anthropology. And then he said, therefore, a health worker professionally responsible for ascertaining death can use these neurological criteria as the basis for arriving at moral certainty. So a lot of the people, like that book I showed you before, Catholics who are in favor of brain death, they say, hey, look, John Paul's in favor of it. But he does have that little word seem there. And that was back in 2000. And so what we have to do now is check to see if we really do have moral certainty or not, that brain dead patients are dead. And the people on the side of the debate that I happen to be on say no, because vital signs, we've already talked about that at length, indicate bodily integration. 2, there have been brain death survivors. 3, pregnant women with brain death diagnosis have gestated and delivered babies. So these people, if you want to take a picture of that, or you can look them all up online, it's just stunning to look at these people who were declared brain dead and now they're alive or they died later from something else. So you can at least say this, rampant, the most modest way to put it, rampant misdiagnosis exists. And brain death it's a self-fulfilling prophecy, because the only reason some of these people lived is because their family members fought against the diagnosis. If the family members said, yeah, then these people wouldn't be with us anymore because they would have had their organs removed. So, yes?
The percentage, you've got 5 names up there, amongst the million?
Well, first of all, hold on a second. So he said, what's the percentage? I have 5 names up there amongst a million. So the first thing I would say, with all due respect, is even if it was just one name, that's enough. But no, but it's okay. But now your question is, there's a lot, and I'll show you something right now. So, and those are only 5. There are so many you can't believe it. That's why my earlier slide.
How many are there? That's what I'm asking, right?
I'll tell you. I'll give you some numbers. Here's one right there. But just in answer to your question, one of the things I said in my earlier slide was, my goal is modest. I am presenting you a side of this discussion that is rarely heard. So that's kind of neat. You get to hear something that isn't hardly ever talked about. But my goal is for you to go look. I could give you a number if you wanted. I haven't calculated them all. It's a lot. But if you just go start looking, I think you'll find things that will be surprising. So here's a more recent case. This guy, T.J. Hoover, he had a brain injury from a drug overdose and was declared brain dead, and his sister fought for him. And there was a congressional, you look this up, this congressional hearing that just happened a few months ago, focused on a particular place in Kentucky where there were 73, so that's a number. 73 cases of, and all the documentation is there, of people who exhibited signs that the organ donation process should have been called off, and it wasn't. So there's 73 at one hospital in Kentucky. This was a big congressional study just done. You can watch the hearings probably, and you got to start somewhere, and then you can see how much more. So that's Zach Dunlop. There he is on NBC today. He, do I have a slide on him? He had an ATV accident. You could watch him do lots of interviews. He was pronounced dead November 19th. Family agreed to organ donation. His cousin, who was a nurse, thought he wasn't dead, took his pocket knife out. It was closed. He didn't open the blade. And he just like jammed it into his foot. And he moved. And at first the nurses were like, no, did it again. So they called it all off. 48 days went by, and now he's on TV. And he said he could hear the doctors. So there's a state called locked-in syndrome, which is a case of someone's conscious on the inside, but they can't let anyone know. That's an actual state, okay? And many of these people who have survived brain death, not all of them, but a good number of them were in locked-in syndrome, and they tell you what they heard after they, okay. This girl, she's another case of one in Texas who had a serious brain injury at 14 weeks pregnancy, and there's a law in Texas where you can't remove life support from someone who's pregnant. It's harder to remove life support from someone who's pregnant legally in Texas than someone who's not pregnant. And so they were obeying that law, but her husband wanted it removed for whatever reason. I'm not judging him. I don't know the case inside and out. And eventually, 22 weeks pregnancy, they disconnected her, and she and the baby died. But she was gestating the baby for 8 weeks. But there's many cases of these brain dead women who have delivered the baby, then they removed the life support, and that's when I would say they died. This is the most famous case. Jahai McMath. She was in California. She had sleep apnea and snored a lot, and so she was embarrassed about all that, and she wanted it fixed, and so they did a tonsillectomy on her. And the evening of the operation, she was bleeding profusely inside, and the doctors were kind of too busy to help her. It's kind of a terrible story, but anyways, everything in California said, no, she's dead. And the case got so big, it was a big national story. You could read about her a lot, and Heidi has a whole chapter on her in the book. They wanted to be sure, so they got like 3 different doctors. They got an external doctor from Stanford University. They did the test like 3 times. It was just, she passed. It was flying colors, all the brain dead tests. And her mom was like, I don't think she's dead. She doesn't look dead to me. The only state in the country that has a legal loophole for religious reasons to reject brain death is New Jersey. So to make a long story short, she raised some money, flew to New Jersey, and Jahai lived until January 22nd, 2018. So she still, right now to this day, has 2 death certificates on the book. The California people didn't remove it. She went through puberty during that period. She was pretty minimally conscious, but her mother used to say, Jai, move the FU finger, and she would do it, and things like this. And on the charts in California, one of the doctors wrote, diabetes insipidus, consistent with hypothalamic death. Diabetes insipidus, if I understand it correctly, is watered down big amounts of urine coming out of you because the posterior pituitary isn't working. Well, to go through puberty, the anterior pituitary has to work. So tests, global ischemic penumbra. So there's this guy named Dr. Coimbra, amazing doctor, and you could look him up online too. And to make a long story short, one of the tests that they want to add is a brain blood flow test to check if all functions of the whole brain are not working. And but the problem is, as I said before, when your brain swells, there's nowhere to go because you have a skull, and that smushes the blood vessels in the brain. And so the percentage of brain blood flow diminishes. And there's this state, which everyone actually goes through at some point, like it's logically impossible not to go through that state, called global ischemic penumbra, which mimics brain death. What it means is that the brain blood flow in the brain is somewhere between, if I get this right, 20 and 50%. If the brain blood flow is in that range, then what you have is brain vitality is present because there's blood flowing through it, but brain function is not present. The brain sort of shuts down its functionality when the blood flow goes low. Now, in that state, if you do the brain death tests, it's going to come out that the person is brain dead. So, if you're in a place where brain dead, organ donation, that's going to be the next step. But what Dr. Coimbra not only said, but developed, is we should treat people for potential global ischemic penumbra. And he has an actual hormonal and hypothermic treatment protocol that can help get the brain blood flow back up and heal the person. Now, maybe in some of the cases, it's not going to work because they have such a bad brain injury and they're going to die. But in some of the cases, it could or will. She, I think, clearly had global ischemic penumbra in those first tests. And the thing about puberty is, and you can correct me if I'm wrong, but I think the anterior pituitary hormonal generation doesn't start until puberty. And she hasn't been there yet. So that part of her brain was quiet only because it wasn't ready to wake up yet. But then it woke up when it was time. So she had partial, and it seems like she was even conscious. Skip some of this. Yeah, I might, because I want, probably there's more questions. Let me see. Heidi talks about informed consent. Yeah, I'll skip these. Okay, I'm going to end so that we can have 23 minutes of questions. If there's not a lot of questions and you want to see other ways that they get organs, I can talk about that. So, okay, questions? Let's do a new person and then you. Yes?
I met a man whose wife was in a vegetative state for 8.5 years.
Uh-huh.
And they did everything. They put the shunt in, they had to change it several times, she was eating food. There were lots of times when you couldn't let her go. And they told her she was never going to be better. But they think she had some consciousness, because every now and then they'd ask her a question and they'd tell her to blink, and she would blink one eye.
Right.
So, but she did finally die 2 weeks ago. Because
2 weeks ago?
Yeah, because they said they were going to just let her go because she had a lot of urinary tract infections. to get to the hospital. And so they finally let her go within a year.
Okay. So just maybe for the camera, because I noticed that I've seen recordings and the questions don't come. I should give you guys my mic when but she talked about a friend's wife who for 8 years was in 8.5 years in some minimally conscious, potentially vegetative state, but would occasionally respond by blinking to questions, who event 2.5 weeks ago passed away. And I guess what I would just say to that is, you know, there is the, and I can't, a lot of times, especially when I give the talk about end-of-life issues, a lot of times people, even more than what you just did, will raise their hand and tell me some story and ask me if they did the right thing. And I say, I can't answer. I'm not there. But right, and that's another whole, right, that's another whole part of my other set of talks about yeah. I guess the short answer to the question is, what we need to do, I think, is care for people lovingly until they die a natural death. Care for people lovingly until they die a natural death. Don't kill people. And there are those difficult moments of discernment when it's hard to see if something is extraordinary or ordinary. And in those tough times, you pray, you talk to your doctors, you talk to your priest or whoever it is, and you do your best. You say, I'm not trying to kill this person, but maybe death is approaching and this treatment here seems to be extraordinary and I think we're right here. And so you remove it and you hold their hand and they pass, okay? But that, discerning that difficult situation, that's not what the Lila Manfi-Sapinski Compassionate Care Act is. That is making it legal to give someone an overdose. Okay, and that's, okay. But, so, and then you mentioned living will. I'm not going to go into a lecture on it, but there's a whole theory about different types of end-of-life documents, some of which really allow euthanasia, and some of which don't. And I think the best is having someone who loves you and believes what you believe be your healthcare power of attorney, and don't check all these boxes. I don't want a feeding tube. Don't check them, because you don't know what it's going to be like. Maybe you check a box, and maybe exactly what you need to save your life is checked off not to give you. Yes?
I think it's really important to check them off, because a nurse I knew that was in the cardiac at Mass General had to watch families. There would be one person who, for whatever reason, could not allow the person, and they would be resuscitated over and over. And over.
Okay, so here's what I'm going to do on the end-of-life document question. You're both right. What's happening right now, because we're going to get back to brain death, is the same thing that happened when I gave the other talk. Brain death came up, and I was trying to answer everything in 3 seconds. So the question of end-of-life documents is complex. And what we would need is to flesh it out. I have a talk on that with 3 or 4 different kinds of end-of-life documents and the underlying theories of each one. And I even have some subtleties, because I agree with you. There's ways to check the boxes. So I can't answer it in a short thing. So I'll just kind of affirm that you two are raising a wonderful and important existential question, but we don't have time to go into it now. Yeah.
I want to say I appreciate what your talk is about and what you're trying to say.
Yep.
I've been a nurse for 40 years. I've worked in ICUs, CCUs, CVICUs. I'm now a nurse anesthetist, so I know exactly what you're talking about.
Yeah, you have more experience than I do.
It's a very, very complicated situation. There's a lot of things going on. What I would probably like to see someone talk about is dying with dignity.
That was one of my other talks.
Because many people want to hang on to a loved one, and they're literally decaying in a hospital bed for months.
Right.
So I think that would be a really lovely topic.
Yeah, so just for the camera, she said a very accomplished nurse for 40 years, ICU, and this problem of over-treatment or just keep vitalism, pretending that you can beat death, and family members not wanting to let go, and that's also a way to be an undignified death. And it's a problem now because of the advances that we have in medicine. And that's why I had some of those religious points in the other talk, because, you know, one of the reasons might be also because of a lack of faith. Like if you know that your loved one is going to be with God, if you think this is the only life, you might be more like that. But so, yeah, so there's a whole discussion of dying with dignity and the meaning. I just alluded to it briefly. It was called Ars Moriendi, the art of dying. It was a whole tradition. There's all this literature about it. Going through that dying process, some authors say how you die is the most important thing you will ever do in your entire life. I don't know if it's the most important, but it's going to be one of the top 3 or 4. Okay? So because, and without that full understanding of it, which we, again, don't have time to do now, to flesh out what some of the people have said over the years, it's very beautiful. It just gets reduced to machines and grasping at life. When you don't understand the meaning of life and death and love. Yeah.
Well, I'm actually curious what your other organ donation scenario.
Okay.
I also was a cardiographic instrument for years.
Okay.
I agree with her 100%. So one person that you said, if they were wrong one time, that life matters. Agree with you 100%. But there are so many people's lives have been saved by organ donation.
Right.
That if you cut off brain death, you need the heart to circulate to get all those organs.
Right.
So I'm curious as to what.
So, okay, now let me just repeat that for the camera, because that's a very important point. So she said, also a cardiothoracic nurse, ICU, lots of experience. She made the point that the heart has to be beating in order for it to work in the recipient. And if, to quote you, we cut off brain death, all that is gone. Nobody will get hearts anymore. Now, what follows? This is the part where, don't get mad and huff out of the room. Okay, thank you, because that actually happens sometimes to me. But if the view that I presented is true, and I'm going to connect this back to the faith point, it does follow that there should be 0 heart transplants. If what I am saying is true, it means that every single time a heart worked in somebody else's body, it was because it was cut out of somebody who was alive. And the act of taking the heart is what killed that person. And you yourself said the heart has to be beating. It has to be, because it needs to be perfused until it's taken out. And so it does follow from my view. This is like the shocking thing. I actually do hold the view. I could be, I'm happy to learn and see if I'm missing something, but I currently hold the view that there should be no unpaired organ transplants. Because the only way to get them is by cutting them out of people who are alive. And I don't think that is right from that quote from a long time ago. You can't just take organs from people to stick them in other people. So you're right. You are right that it's dramatic. It means, you mean, wait a minute, we're not going to have brain death anymore? That means no more organ transplantation? That is what I mean. And you can disagree with me, but now you understand what I mean.
Right.
Okay.
It's just like polar opposite thought process. Like my thought process is, if I was tomorrow in a car accident and they told my family I was brain dead, I would happily go up to heaven and give all of my organs away.
So actually, no, I'm just going to, let me,
Polar opposite.
yeah. So I'll just, to make sure the camera hears what you said. She said she and I have polar opposite views, because she would, if she was in a car accident and got a severe brain injury, she would be more than happy to let them take her organs for someone else. Right. So one of the, I mean, if you want to see them, I'll just do them really quickly. One is donation after death by traditional criteria. So that's cardiopulmonary cessation and wait a while. And in this one, do I have my, oh yeah, because this is partly because I did this to a room full of like, I was actually in a, if you want to watch it, it's kind of fun. I was in a debate in front of 300 medical doctors. It was me and a cardiologist, and it was a priest and a heart transplant surgeon. And me and the cardiologist were against brain death, and they were in favor of it. And it's pretty rambunctious, and it's run by like a professional debate coach. But and this was one of my slides. But so yeah, so all Catholics accept that. The problem is you can't get hearts to work if you go by that. Then donation after brain death, that's what we're talking about today, and that's an intra-Catholic debate. It continues, and it's also an intra-secular bioethics debate. Donation after cardiac or circulatory death. So what this one means, and this one has an intra-Catholic debate. So this one means that the person has a severe brain injury, but they're not brain dead. They don't pass the tests. So what they do is they made a protocol where the time frame is different in whatever state you're in. So they wait, they get the person all prepped to take the heart or whatever else. They wait, they take the life support off. They wait and watch carefully for the last heartbeat. Then some places it's 2 minutes, some places it's 5 minutes. They wait 2 minutes and then they take everything, okay? And they're claiming, that's like that permanent irreversible, because they're claiming they're dead after the 2 minutes, but the problem is autoresuscitation can happen after 10, or the heart's going to beat in somebody else's. So, okay, so anyways, there's a debate about that. I'm not in favor of that one either. I don't think you can know the soul left the body. This is a new one. I don't know if you've heard about this. Normothermic regional perfusion and donation after circulatory death. This one is bizarre, and this one all Catholics reject. And this is big in the news right now, not maybe on the nightly news, but it's talked about a lot, and there's huge debates about it. The short version is, if you have somebody who, I got to get the order of this right, they have a brain injury, but they're not brain dead. Their heart is beating. They wait for the last heartbeat. Then I don't know if it's, I haven't studied this one as closely as the others. They wait for that, but this is how it is. They wait for the last heartbeat. Thing I just hesitated on is, I don't know how long they wait after they do this next thing. But after the last heartbeat happens, and whatever the waiting period is, they physically clamp off the blood vessels to the brain. Then they start the heart again. So the blood can't get to the brain. So what does it mean? It means the person's alive, they don't pass the brain death test. They make them be dead by cardiac or circulatory because the heart stopped. Then they clamp off the blood vessels to the brain and start the heart again. And now they're dead for a different reason, brain death. But now the heart is perfused. And so they can do the organ extraction. So they're jumping through hoops to not violate the dead donor rule. I would say pretend not to violate the dead donor rule. But that's a big thing in the news right now. You can look it up. And it's interesting, that one, some hospitals even, secular, are saying we're not doing that. This is too wacky. And some are doing it. It's a big debate right now. And then this pertains a little bit to the last thing you said. Some of the people on the cutting edge of, it's kind of interesting. So you can tell I'm holding kind of a more traditional Catholic position. But on the cutting edge of secular bioethics, like people like Peter Singer, if you've heard of him, or Robert Trug, and people like me or Joe Ebley or Heidi, we have one thing in common. We both think brain dead people are alive, which is kind of funny. But the difference between us is, myself and my colleagues, we think, therefore, you don't cut their heart out. You don't kill them. You have to love them into a natural death and all that. Those guys think, you know what? They're alive. Let's stop this farce. Like the most secular bioethicists say, you people are just pretending. They're obviously alive. So they say, let's change it so that we don't have the dead donor rule anymore. Somebody can sign a consent form that says, I know I'm going to be alive when you cut out my organs. Make sure you give me enough anesthesia so I don't feel it, but do it so other people can have my organs. That's kind of like what you were saying. And so there are people arguing for that. And I just want to say one more thing about this one. So I would be totally against that one. It sounds like you're for it. But you're for it. Okay. So, and she's Catholic too. All right. So okay. The other thing I want to add about that last one is the next step of that, and it's already being talked about, is marrying this last one with the legalization of euthanasia, so that you can pick that as your method of euthanizing yourself. Instead of an overdose, you can pick having your heart chopped out to put in somebody else.
You should bring more nurses into your view, because you keep mentioning doctors, who I love doctors, I respect them.
Oh.
But the nurses at the bedside,
Oh, yeah.
caring for these people for
I know.
months,
Yeah, I agree with you actually.
it's a big thing.
Well, actually, you know what? Well, let me, for the camera.
Yeah.
She said I should bring nurses into the picture, and you're 100% right, and it's amazing and beautiful what the nurses do. And actually, I would like to. So one of the things that normally, I didn't do it in Circle of Scholars, but normally when I go, a lot of the parishes around Rhode Island, especially when the bill comes up, they ask me to come and give talks about it. And I typically always bring with me Dr. Tim Flanagan. I don't know if you're familiar with him. He's from Brown University. He's a very accomplished infectious disease doctor. He's also a Roman Catholic deacon. And so we do that together. And it's very better because I'm not a medical doctor. But I would love to do it with nurses also. And to get that sort of human, long-term care reality. It's just, since there's you haven't spoken.
Bring up a question.
Yeah.
Since I don't know what soul is, if my heart is beating and goes to another body, how can we have that person alive?
So she said,
Soul is in my heart.
so, and, right.
Another body. A lot of people who are recipients of transplants will be absolutely open to that.
to,
Yes, I have two souls.
oh, yeah. So let me just say it for the camera. So she said, and I gotta keep it, I might be overtime here. Oh no, we still have 5 minutes. So she said, if my heart is still beating and then it goes into somebody else, and I don't know what a soul is, aren't I still alive? And there's an area of study in this realm that I've only tangentially seen. I haven't really looked into it. But from what I understand, from little like footnotes and things I've read in my research, there does seem to be this phenomenon of people having certain little personality traits or something of the people. I have to look into it still, but that has been commented on. So, but you just raised a question that would also be needed to be like fleshed out, namely, what is the soul and what is the body-soul relationship? And that, the other talk I gave was one way of discussing that. But yeah, so, okay. There's just someone who hasn't, 1, 2, we'll do 1, 2.
Are there any countries that allow an estate to pass with the BDI person?
Oh, that's a good question. So he said, are there, if someone has brain death diagnosis, can, like, the will be executed? Is that what you mean?
Exactly.
Yeah.
It might be beneficial to a widow,
Yeah.
vice versa, children, whatever the
That's
situation.
that's a great question. That it's one of the ones I haven't looked into, but that's an interesting question. So, like, we could take one of the cases of the pregnant women, who she has a brain death diagnosis, so there's a death certificate signed, but they're keeping her on all the life support to gestate the baby to viability. So you're saying is it in that case legal to execute the will? And I can't answer because I haven't studied that question, but it seems to me the obvious answer is yes, it should be. She has a death certificate.
Okay.
Did you want to follow up? Or?
I understand that, right, but I just wonder, America's usually lags behind assisted suicide, maybe in advance, like Sweden or Denmark would allow that. Maybe they're at a point even in their legal system that would allow a state to pass with a BDI individual.
Yeah, that's a great question. So are there any, he's asking me if there's any jurisdictions anywhere in the world where if someone's declared brain dead, but for some reason they are sustained for a longer period of time with their heart, with all those vital functions happening, can the estate pass or the will be executed and all that? I just don't know, but it's a good question. You hadn't spoken.
Thank you for addressing such a very difficult subject. So
Thank you.
Thank you.
Okay. Thank you for being nice to me.
And on the other side as well, I would just like to say, both John and Paul talk about compassion, and I really do feel like it's you nurses who are listening to him, and you are faced with the reality of, medical treatment and how it affects everyone. So I think kudos to the lecturer, but to the nurses as well.
Yes, of course, yeah.
Yes, and let's say, okay, I'm at my 80s. Let's say I go to my remember will, and I say, okay, if my brain dead, I left.
You're what?
Let's say when I die, whatever death is, I would put in my will that if my brain was dead, you would use to open up the
Organs.
Or, organs.
Right, so she said, what if I put in my living will, if I am diagnosed by the, let's say, the American Academy of Neurology brain death guidelines, and I pass them, can I put in my will, you can take my organs? And that is this, except, yeah. Well, no, actually, hold on a second. That is allowed already. That's allowed already. Sorry, that's not this. That's allowed already. Yes, that's what people do. That's what people do. So that's what, you know what else, by the way, every time you check that on your driver's license, that's what you just said. And that's what, the whole section that I didn't talk about here was informed consent. So, and this is kind of a serious point. If some teenager goes to get his or her license and they check that goes deep in. From what I understand, you can't just go to the DMV and uncheck it. It's in some sort of system, okay? Now think about this. Some 18-year-old kid gets in a car accident, has global ischemic penumbra. They declare him brain dead, and it says he's an organ donor. But he has global ischemic penumbra, and we could treat him, and he could become healthy again. That is not going to happen. So he's not going to be treated. And so I think that when people get their driver's license, they should be given the chance to have informed consent about everything I said today. About global ischemic penumbra, about how the brain test is done, about what treatments are for serious brain injuries, about what you are actually saying. I think it's flabbergasting that you're 16, what's your birthday? One more thing, organ donor or not? Sure. It's absurd.
I did hear that the DMV approval supersedes medical proxy.
Yes, there's all sorts of, she said the DMV checkbox supersedes medical proxy. And there's all sorts of, maybe you could fight really hard, but let's see, you've had your hand up for a while. Go ahead.
You started this off describing brain death in a certain way. That's the brain is
irreversible cessation of all functions of the entire brain, including the brain stem.
They're using secondary mechanisms.
Yes.
trying to determine whether the brain.
Yes, I'm going to repeat it for the camera. But he said they're only using secondary measurements to determine that, namely,
Obviously, error.
and there are errors that happen because of
Now,
that. Yes.
back to the very thing I was mentioning earlier. You can in fact see how to detect neuron activity.
They're not, okay, I'm not a medical doctor. From what I understand,
Closer, you can actually detect firing neurons.
Yeah.
You could literally, if you could,
Right.
let me just make an assumption here.
Go ahead.
If you could now say, if in fact this shuts off, if you do a test,
Right.
black,
Right.
brain dead,
Yes.
how would that fit into it?
Okay, great question.
Theoretically, you can
Right.
do that.
Okay, great question. And this will be the last question, I think, because I think we're at 4:30. So, but it's a good question to end on. So he said, let's say there is a test. So they do the brainstem tests, and it all works. And then they do this new test that you're imagining, which is this like supersonic MRI that can test. And I think you would have to say that no neurons are firing anywhere in the brain. So if we had such a thing, okay, if that happened and we had true brain death, and this kid TK, he had brain necrosis, okay? So then if that happened, then the debate becomes, a person like that still has all those bodily functions working that Dr. Schumann discovered. And so now the debate becomes, is that person dead, or just brain dead? That's the question. And what it's based on is, what happened, this is another part of the slides that I had to leave out. People used to argue, not too long ago, that the brain is the master integrating organ of all of the other bodily functions working together. That's what they used to argue. And so those people said, when the description of brain death happens that you described, all the organs will very soon stop functioning and disintegrate. Surprise, surprise, it doesn't happen. All the organs keep going if you just keep them on a ventilator. What that means is that the brain is not the central integrating organ of the integration of all the other, and everybody accepts that now in this debate, actually. So you're right. Both of your questions, your earlier question and that question, are the parts of the talk that I left out.
By the way, and I don't want to, we can talk about this.
Yeah, I can. Yeah, we better stop.
Literally in laboratories, you could create, they're doing it now. They're building bodies, they're
Yeah. Okay.
growing organs, they're doing the things that are left over after
Yeah,
this.
yeah. Okay, we'll talk about that after you and me. So thank you very much. Thank you. Yeah. Actually, let me. No. No, no.